Welcome to the South Asian Public Health Association Spotlight Series, the platform where we spotlight the remarkable journeys and career trajectories of trailblazers in public health, with a special emphasis on the South Asian community. We're your hosts, Samira, president of the South Asian Public Health Association, or SAPHA, and
Anita, co-chair of the Event Planning and Professional Development Committee for SAPHA. SAPHA is an organization dedicated to advancing the health and well-being of South Asians in the U.S. and the communities in which we live. And SAPHA has been instrumental in fostering collaboration, advocating, and research to address health disparities and promote equitable health outcomes. Today marks a very special occasion as we kick off a series of interviews commemorating the 25th anniversary of SAPHA.
As your hosts, we're thrilled to delve into captivating conversations with influential figures in public health. Stay tuned for inspiring stories, insightful discussions, and a closer look at the impactful work of SAPHA over the past 25 years. Learn more about us and explore the wealth of resources we offer at www.sapha.org.
Our inaugural episode, which I'm very excited about, features a trailblazer, one of the co-founders of SAPHA and current professor at University of California, San Francisco, in the departments of obstetrics, gynecology, and reproductive sciences, whose vision and dedication have laid the foundation for a quarter century of impactful work for SAPHA. We're honored to have you with us today, Dr. Ushma Upadhyay, and welcome.
Wow, thank you so much for having me.
Yeah. So Ushma, welcome to the SAPHA Spotlight Series. Before we dive into SAPHA's journey, let's start with a glimpse into your own path in the field of public health. So would you be able to just take us along, your journey through your career in public health and illuminate how your path led to the inception of SAPHA?
Sure. I would say it started in undergraduate. In undergrad, I had been thinking about what was my next step in life. And I had traveled, I had studied abroad in college, I went to Bolivia, and I had been thinking that I really was inspired by international development. And I had been thinking a lot about what part of international development I was interested in particular. And public health really seemed to be an area where I felt like I could make an impact on a structural level, not in terms of medicine, but in terms of public health, thinking about policies that could improve people's lives around the world. So I started in international health. I went to India for a year after college just to experience it, to work for a nonprofit there and really understand global health issues. I was volunteering. And then from there, I applied for MPH programs and joined Columbia University, where I studied population and family health. And that really got me onto the track of working on reproductive health issues. So we're at about 1998 at this point. And then I moved to Baltimore for my first job after my MPH. I worked at Johns Hopkins at my first job, writing for a publication on population issues. It was called Population Reports, and it was a magazine. This is before the internet was accessible. So the purpose of this journal was to be sent to reproductive health clinics around the world to provide information to providers and health systems, to other professionals about developments in family planning. And so that was really my start. And then when I was in Baltimore, I was there working at Johns Hopkins, so I applied to the PhD program since I was there. And so it was those years that were really instrumental in thinking about an organization that would that could serve South Asians or serve South Asian public health. I had began to network with other professionals at the time, and we realized that there was no central organization that was focused on furthering the health of South Asians in the United States. I was I was meeting lots of people. I working in other fields, and there seemed to be South Asian organizations in just about every other field. And we thought, we really needed something in public health.
So, kind of taking that a little bit further along, obviously SAPHA wouldn't have existed without you and other co-founders. And as you became involved in SAPHA and the accomplishments grew, I mean, um, what was your specific role when you started with SAPHA, and what kind of different roles did you take on with SAPHA? And when you obviously your interest in South Asian public health came even before SAPHA started, but how did SAPHA change you or in terms of like inform you differently about South Asian public health as an organization?
Yeah, there's a lot in that question, and there's a lot to say. The I think the first inspiration for SAPHA came from my co-founder at the time, Obijit Ghosh. It was really his, I would say it was his brainchild. He really thought we need this organization to further public health, to think about issues related to public health. And so I would give the credit to him. I said, he wanted a partner in this. We were already friends, working on other things, and um, I think that's really how it started. And so we said, okay, let's give it a shot. In Baltimore, there were a lot of people working on public health issues, not necessarily on South Asian public health. And that was the thing at the time.
Yeah,
There weren't many people working on public health among South Asians. There were lots of South Asians working on public health.
right.
And we were really clear, and I really loved hearing that the mission is similar. It's still the same from those days, because we were really particular. We had long conversations about this. Like, is this an organization about bringing together South Asians working on public health? And we really wanted to be clear that this should be an organization, doesn't matter who's working on public health among South Asians, but the organization should be interested in furthering the health of South Asians in the US. And that should be the goal, because there wasn't at the time that much going on. There was very little research. And so to answer more of your question, that's when I went through this sea change of thinking of, like, there's no data. A lot of my job at the time at Johns Hopkins writing for this publication was all about data. And I thought, there's no data on South Asians in the US. And it was so hard, even among populations with even in areas with high populations of South Asians, it was hard to get, like New York City, Houston, New Jersey. It was hard. So yeah.
Yeah, I mean, it's always important to have a good collaborator, and I think that he's going to be on our list as well, the co-founders and others of SAPHA co-founders to interview. So thank you for mentioning that. And you mentioned, of course, data and how you learned a lot more about data or lack thereof, through your role at SAPHA. How else has your experience with SAPHA influenced you in terms of your trajectory in public health or even personal growth? Because I think really future public health professionals are looking for ways in which they can connect inside of work, outside of work, and a mission they can connect to and can feel passionately about. So how has this trajectory helped you both in public health and perhaps even outside of that?
Yes. I would say, I didn't, from there, I didn't continue my work in South Asian health. As I mentioned, I started a doctoral program. So I had written an entire dissertation proposal. I still have it on Google Drive, that is about looking at sexual and reproductive health among South Asians. I tried to do it. I talked to many different people, and at the time, every faculty member I talked to about this idea, just it just seemed too difficult. At the time, there wasn't internet recruitment really, and it just there I was dissuaded from taking on a topic that they didn't have connections to. They didn't have organizations, and I was just dissuaded from taking on a topic where there was so little preliminary work, where it
Mhm.
would be difficult to reach populations to survey. And so, in the end, I wasn't able to do that dissertation topic, I ended up using secondary data that my advisor had. Um, but today I am thrilled to say that I am mentoring an early career faculty member here at UCSF who is submitting a an NIHK award to look at sexual and reproductive health among South Asians in the US.
Fantastic.
That's
I
amazing.
know, I'm so excited. Her name is Sneha Challa. And if you're interested in the topic, feel free to reach out to her.
Definitely.
Yeah, but I'm just thrilled to be a mentor to her on this work. And it's kind of, the living out my dreams through my mentee is pretty much what I'm doing. There's like no hiding that.
You couldn't have provided a better segue because the next question is actually, about mentorship. You talked about your role as a mentor now, but kind of turning time a little bit back, were there any mentors or role models who've influenced, or are there any mentors or role models who've influenced your career in South Asian public health? And what lessons did you learn from them and to get you to this point?
Yeah, I think at the time there weren't many mentors in public health of South Asian descent. I feel, you know, uh, my family, and I'm sure many of your listeners and many members of SAPHA can relate. I felt a lot of pressure to go into medicine from my parents. You got to be a doctor. You got to be a doctor or engineer, right? I'm sure
Yeah.
we all hear that, and I was from the beginning, I was very clear that I did not want to go into medicine and public health. Through public health, you can improve lives on a systematic level, structural level, and that's what inspired me. Um, in terms of mentorship, I think that at each place that I was at, I drew from people who I worked with and whose work inspired me. I was not as I probably could have, in hindsight, gone back and said, asked more formally, will you be my mentor? Will you mentor me on this? But I think I was kind of a silent admirer to my mentors. And maybe they didn't even realize that they were my mentors at the time through every stage. And um, I kind of wish I had been more active and uh, upfront about it. That I would like you to be my mentor, and will you take me on and teach me?
So besides being proactive and going out and doing some outreach, are there any other advice you would have for our listeners and the next generation of public health professionals? And what have you learned from your own mentorship for your NIHK seeking grantee and a young junior faculty member that you would like to impart to others as well, in terms of if they're looking for mentors out there, what advice would you give them?
Yes, definitely. I would say look for people who are uh, respond to you, are kind to you, who give you time. I probably admired too many mentors that didn't have the time for me, and maybe that's why I didn't ask. So keep seeking people who will support you and give you energy, who believe in you and believe in what you want to work on, and uh, someone you have good rapport with, someone you're not afraid to approach, and someone who you can connect with.
Mhm.
It's really important. And I also think, you know, I think there's, reach out, ask for an informational interview, ask them what their career path was to get to know them and to see if you're in sync with goals and priorities. Like if you meet with them and you hear that, maybe all they did was like work, 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 and they didn't, actually enjoy life going through it. Maybe that's not the right mentor for you. Maybe that's not the person that matches your your style. So I think it's important to connect with someone who has kind of similar priorities in that way.
Yeah, that's so important. And then, just in your role as a mentor, what advice do you have for others who are looking to mentor, emerging public health professionals? I think that's also, an important thing,
Yes.
how to be a good mentor.
Yeah, I think making the time for the next generation of public health leaders is really important. Um, Conveying the values that you want to see, not the values that you were trained in necessarily, but the values that you'd like to see in the next generation. Like just because you had, you know, you had to do a postdoc and that was the only way into academia, like don't uphold all of those rules for the next generation. Think about like what you can change to make academia more accessible. And so it's really about um yeah, I think yeah, finding mentors that have can advocate for you. So important.
Yeah, definitely.
So just one more question before we transitioned to SAPHA focused, the SAPHA chapter of your life, chapters of your life. What is the biggest lesson that you've learned in your career thus far? I mean, in terms of whether it's mentorship, whether it's the research focus, et cetera, the focus of your research, what is the biggest lesson you've learned in your career? And given that it's 25th anniversary of SAPHA, what is the one thing that you wish you knew 25 years ago that you would like the next generation of public health professionals to know?
Yeah. I think I have two most important things. The first is work-life balance. I think I must have been trained early on to just work, work, work.
Mhm.
And I if I, I think in hindsight, I wish I had forced myself to find more activities, force myself to go hiking or force myself to take on or learn a new activity or learn a new skill or learn, like pottery or try something new. I think um, if I had to do it again, I think having more work-life balance as my culture would have improved. I think it would have improved my whole life trajectory. And so I think if I have advice for others, I would say don't, you can be passionate about your work, but don't ever let it get in the way of a full balanced life. Um, and so that's one. And then the second is, yes, also make sure that you're choosing a topic that you're passionate about when you are working. Make sure it is work that you're passionate about. Otherwise, maybe try to find something else. Even if you've already invested a lot of time, it's okay. It's never too late to search for something that just like keeps you going and makes you excited to get to the computer each day.
If you're working on something that's fun and that excites you, there are still going to be days that are a bit of a chore, but probably not as many days because you're working
Absolutely.
something that excites you. Well, with that, I'll turn it over to our president of the SAPHA, Dr. Samira Khan. She's not a doctor, a professional doctor, but she is a doctor to me because I've learned so much from her. And she's such a good mentor to me, speaking of mentorship. So
Oh,
Samira, take it away.
thank you so much, Anita. I mean, I think you really hit the point home with the work-life balance. And I know, as taking SAPHA on becomes this extra activity that you're doing. And it's hard to draw the line between work and then more work, but it's like you're also really passionate about it. And so I know that's definitely what I've experienced in the past few years. It's just that, you're just so passionate about this, you want to see it grow. And so, we want to rewind time a little bit and take a journey down memory lane for you. So what did you enjoy the most during your time with SAPHA?
I think the best was all the people that you get to interact with every day. And
Mhm.
I remember those like late nights, like working so hard. So I want to take a minute to thank you both for your tremendous sacrifice and service to our community and to the organization. It is a lot. And I don't think it's all behind the scenes and people don't see what your lives are like day to day and how much work it goes into, how many hours. And not that it's a lot of it is fun, but it is a lot of time that maybe you could be putting into a pottery class. Um, it's a short period of your lives, and it's just wonderful that you're dedicating this time to this important cause.
Okay.
Um, so it was, yeah, the time spending with our board member. Our board was pretty close, and just having calls, and I think the times we got together were really great. But I will say the brown paper was really, pretty much my first baby of my life. It came out, it was I was the primary editor of it, and it came out before my dissertation, several years. I think
Oh,
I
wow.
remember the
Wow.
first year it was published. The first version was actually brown. I don't know if the current version did, but I have a copy on my shelf at home. It was a tremendous amount of effort from all of our board members and all of the writers of each chapter, and trying to pull that together and bring together all of the research, whatever was available. Sometimes it was, for some chapters, it relied a lot on research coming out of other countries, the diaspora. And so, but just, going through, reading all of them, formatting in Microsoft Word, just all of that, like getting, asking our membership for photos that we could add to the brown paper. So it was just tremendous. And it took a year and a half, at least, something like that, to get the chapters, to re-edit them, send them back to the author, get the peer reviewers and coordinate them. And it was just an amazing, fun, and huge, rewarding effort.
Yeah, that's so exciting to hear. The brown paper still today is, I think, referenced in all of our orientation paperwork and all of our, like, yeah, anything that we put out, the brown paper is the first thing that gets its spotlight. So, even 25 years later, it's really just such a significant achievement that we've made. That's one of the best things about joining like organizations like SAPHA and volunteer opportunities. You get to be a part of something that's bigger than, what you might be doing in your day-to-day life. And so what advice do you have for, future professionals or public health students on getting involved with volunteer opportunities like this? How do you discern between, what to take on, what to reject, and where to look?
You mean in terms of
Like,
opportunities and
yeah, to volunteer with organizations. Yeah.
yeah. I think that it's good to start with organizations that you're a member of and that you appreciate, that you feel like, yeah, this organization makes a difference for me because I'm getting this. I learned about this internship opportunity, or so I do want to encourage volunteering, whatever capacity people have time, because they can make a difference, even if it's a few hours a week. Um, and again, I'll go back to that theme of thinking about work that um, people are passionate about, or topics that they're passionate about. I have a friend here in the Bay Area. She's 50. She just turned 50, and she just started volunteering for Narika as a taking calls from, it's an intimate partner violence organization, and she went through a 60-hour training to become a volunteer. And I'm just so it, just inspired by her, that even though she has a full-time job, she works for Pinterest, she has a lot on her plate and two kids, that she's starting this volunteering now. I'm like, I just think it's so wonderful. And so it's also, if you don't have time now and you want to wait to, there's always time to volunteer when you're looking to do more in your life.
Yeah, that's absolutely true. There's never the right time, it's whenever you feel that it's right for you. And I think that's so important to, for people to know, because I think a lot of people feel like they have to rush and get everything done as soon as possible. But, you have so much time, and, just look at SAPHA, right? 25 years since you co-founded it. And we've just achieved so much in that time. I mean, SAPHA has obtained 501c3 status. We've published influential research like the Brown paper, which you were the first editor of. We've received prestigious awards. We've had critical partnerships. There's a lot of health equity work that's being done. SAPHA's impact has extended to legislative advocacy. We've helped to advocate for the South Asian Heart Health Awareness and Research Act. We've participated in national campaigns. We've also started to establish a noteworthy presence in Washington, D.C., which I think has been going on for many years. marked by engagements with the Secretary of Health, invitations to the White House, invitations to key conferences. And we really, I think, establishing this massive network to address health disparities and promote equity in South Asian communities. And it's really, 25 years of board members dedicating their time and effort to volunteer to SAPHA to get it to this point. And it's really the collective that has really brought SAPHA here. So given all of this, where do you think SAPHA can be the most impactful in the next 25 years?
That list of accomplishments is incredible. I just had chills hearing it all. It's just unbelievable. So we should just take a minute and just
Absolutely.
cheer for us, for you. It's just amazing. And it just goes to show how much potential there is, right? Like how much work there is to be done,
Right.
and how much the organization is needed in 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 the US public health system. There is no other voice for South Asians in the US, and we need to be at the table. And so there's so many tables discussing public health, and no matter what the health topic is, like we should be there. Someone who is advocating for public health for South Asians. And so in that vein, I would say over the next 25 years, expanding membership, so extending the organization's reach so that we have a person at every public health table, whether it's, looking at HIV/AIDS, looking at transgender health, looking at LGBTQ health, looking at, diabetes care and heart disease. We've had people at those tables for a long time, but just really expanding the tables that we are at seems like a priority. I would also say so similarly also expanding regional presence of the organization. I feel like when I lived on the East Coast, so after Baltimore, I ended up moving to New York City, and people had heard about SAPHA, and there were SAPHA members living in New York City at the time. But in the Bay Area, I have to do a little more, when I talk about SAPHA, I have to do a little more orientation. So I think, there's geographically, there's more work to be done in terms of extending its reach. I think when we were starting up, we were considering having satellite SAPHAs. We were going back and forth. I don't know if there's anything like that now.
Not yet. We have talked about opening up chapters of SAPHA across the states. I think really it's the capacity building that we need to focus on next to get there. But I agree, really expanding, going from a national to a regional level is important so that you can tie it back to the work that's being done in the communities.
But
Yeah.
I do want to give credit to our president, Samira Khan, as well, and other board members, because I think there's an intentional effort to diversify the board itself that guides the direction of the organization, and to bring in different perspectives and people in different geographic regions and professions, et cetera, to make sure that SAPHA is well informed in terms of our mission, vision, history, and mission, vision, and values. Over to you, Samira.
Thanks. Yeah, and we're also trying to, form more partnerships, I think, with organizations that are on the ground and community-based organizations so that we can eventually, set the groundwork for chapters.
That's wonderful. I definitely would love to see that over the next coming years of SAPHA's life. And that also goes in hand with getting the name out and, just getting people to just know what SAPHA is. I feel like there are other organizations like the South Asian Bar Association that I hear about, and people kind of know what that is. Of course, there's medical organizations. I think that that's kind of one step towards advocating for more South Asian data. That's really what we need is more data.
Yeah,
I think that would go a long way. South Asian specific data.
yeah, absolutely. I think it's just the lack of data has been something that everyone's been concerned about over the past few years. And I think we finally see a shift towards being more conscious about collecting data. I wish that had been done earlier so that we could have had just more research, or we would have been a bit further apart. But we're just catching up now, which is always a good thing. And then
in any study that I set up, I always ask for disaggregated Asian um, race, ethnic group,
Yeah.
because I think people want to see themselves in surveys.
Mhm.
They want to check a box and not, like after Asian, I'll ask for the subgroup. And no matter how small my study is, I probably won't go to do an analysis disaggregated by South Asians, but at least to show, look, there are South Asians who need this reproductive health service, for example. So just I always, as a policy, collect it, and I think that I owe that to my days at SAPHA with
Yeah.
SAPHA.
That's amazing. I really wish a lot more people did that. I think it would just help with the data collection. And then when we get to a point where we want to, really disaggregate that data, we already have it collected. So I really, kudos to you for doing that. And then I'm going to shift it over back to Anita to talk a little bit more about, what you're currently doing. Go ahead,
Yeah,
Anita.
and I think you've already provided a good segue, Dr. Upadhyay. So just taking a little bit of time to, can you perhaps share with us what you're currently working on? We know you're very passionate about reproductive health from a social justice perspective, and I'm sure a lot of our listeners will be as well. So if you can delve into your role as a principal investigator and your day-to-day role and what projects you're currently working on, and how that connects, how you're able to connect that with your passion for social justice and reproductive health.
Yeah, sure. Maybe I'll backtrack a little bit and
Sure.
finish. And when in New York City, when I moved to New York City after I got my PhD, I worked for the New York City Department of Health, and I was able to work on NYC Haines, which is similar to NHANES, but
Mhm.
it's New York City specific. And I got to work on diabetes and cardiovascular disease issues. I got to work on a paper uh, using NYC Haines on diabetes among South Asians. However, that wasn't really what I was trained in. So I was very eager to get back into reproductive health. There wasn't really an opportunity for me to do that in New York, but also at the same time, my husband at the time had an opportunity here in San Francisco. So I said, well, maybe this is my opportunity to leave this topic that I'm a little less passionate about. I know it differs from many SAPHA members, but I wanted to get back to reproductive health. So we moved here, and I soon joined UCSF as in a research position. It was like a research associate position, academic, but on a faculty track. Um, so if any of your listeners ever want to talk about academia, I'm happy to talk to them about it. I wasn't looking for, I just wanted to do research in reproductive health. I wasn't necessarily thinking I want to get into academia, but in the Bay Area, this opportunity came up for me, and it was to work specifically at Answer, which is where I am now. At the organization I work with seeks to advance reproductive health, and specifically uh, um, collect data and conduct research to inform abortion policy. So a lot of the work I do is on abortion, and so that has really obviously come up a lot in the recent years with the Dobbs decision, which basically overruled or reversed um, the Roe Supreme Court decision, which guaranteed a right to abortion. And so since then, I've been working on a lot of research on the impacts of that Dobbs decision on people's lives. And to me, I've seen a lot of it comes down to equity and health
Mhm.
equity, the impacts of not having access to abortion, which is basic reproductive care, has resulted in deaths. There was a death of a Texas woman last week due to who she was pregnant and had a condition that was life threatening, and she could not access an abortion. And so this is a public health issue. This is not to me, this is not a public health issue. To me, this is not a political issue. This is squarely a public health issue in the way I think about it, talk about it, and research it. access to basic reproductive health.
Yeah, it's absolutely incredibly important and so timely. So I just want to kind of follow up a little bit because, you spoke about the difficulty in collecting data and difficulty in, lack of data that sometimes without sufficient data, sometimes we have to make informed decisions. So could you talk a little bit about how you're able to fill some of those gaps in your current role in terms of data collection and disaggregated data, specifically if you're focused on South Asian communities, and even if not, specifically when it comes to abortion, and it may be a sensitive topic that many women may not want to come forward and talk about it. So how do you deal with the challenge of collecting that sufficient data among disproportionately affected and marginalized communities?
Yeah, wonderfully expressed question. I don't squarely focus on South Asian communities, apart from the work I am doing vicariously through my mentees. But I will take it, I will say that that's work that, I'm contributing to. And so much of that work is through qualitative research on smaller samples. I do think there are ways to do sexual and reproductive health research through, and I think this is something, would be great to have a meeting to like just brainstorm. Could you use panel data? Could you use NORC, some of these like or Taluna, these are companies that collect data. Could you use a company like this to hone in on a specific South Asian population? But that's a separate question. So a lot of the work I do on abortion, for example, one project I'm working on is called We Count. It is sponsored by the Society of Family Planning. I am a lead researcher in this project, and what we're doing is counting abortions. And the only way we can do that, there's many ways to do that, but the way that we think is the most rigorous is to collect data from abortion clinics across the United States. And so it is a very tedious process, but we have been able to connect with about 80% of facilities across the United States that offer abortion care, and they submit their numbers, and then we go through a rigorous imputation process to estimate the numbers of abortions that are provided by the facilities that are not collaborating with us based on the data that we have from the rest of the state. And we are able to estimate numbers of abortions, because it's such an arduous task for the clinics to send us data, we're only collecting numbers, no sociodemographic data, which is like, painful to not be able to analyze individual level data. But so we're not able to make inferences about who's able to make the trip from these states with abortion bans to states where clinics are open and available. We don't know who it is, but based on previous years, we know from pre-Roe days, and we also know just based on our research on the impact of abortion restrictions, that it's people who are most marginalized that are unable to get out of the state. They're unable to travel. And so we know that it's people of color, primarily Black women, Hispanic communities, people with low incomes, adolescents, it's almost impossible for them to get transportation out of state to get to a clinic. And so we know that it's people who have been historically marginalized from healthcare, who are, again, not able to reach a clinic. And sometimes in parts of Texas, Southern Texas and Louisiana and Houston, where there's huge Texas has a large populations of South Asians. The trip is about 8 hours to get to the nearest abortion facility. And for among South Asians, it's extremely stigmatized. On my Facebook page, about every 6 months, I'll post something that says, if you or someone needs an abortion, please contact me confidentially. Like I can help. Because otherwise, if you can't even trust, if there's no one you trust to figure out how I can get an abortion, how can I access these abortion pills, or how can I reach an abortion clinic, it can be so isolating and scary. Even it compounds the isolation and the stigma that that a pregnant person feels.
Well, yeah, absolutely. I mean, and I think this is also, once again, a beautiful segue into the next question. As a social scientist, as a data scientist, as somebody who is, an expert in reproductive health and social justice, let me ask you this. I mean, do you believe this is the most pressing issue of the South Asian communities? And if so, how do you think that we at SAPHA and other stakeholders can help address it, or what do you believe is the most pressing issue, within the South Asian South Asian communities, particularly when it comes to public health?
Mm.
That immediately needs to address, that may even help you with your work, with the data collection, and and help in reducing the stigma so that women can get the care that they need.
Yeah. I mean, I think talking about it, South Asian communities don't talk about sexual and reproductive health. We don't talk about contraception
Yeah.
or sex or, condoms, how to be prepared. And even with adolescents, I mean, this is actually much of what my colleague, Dr. Sneha Challa, is working on
Mhm.
is among the transition to adulthood. Who do they have to talk to? Who can they talk to about, as they transition to their first sexual experience? Do they have people to talk to?
Mhm.
And oftentimes it's going to be people outside their community because they're afraid of the stigma talking to even an older sibling or a parent. I mean, I don't know if parents are talking to their children about sex. I hope they are. I am. I have two wonderful children, and I started talking to them at age 4 about how. I mean, I had a book. It was very structured, and I read the book. It's an excellent book, and it says it's for children starting. It's called "It's Not the Stork," is an excellent starting point with anyone, for any listeners with small children. Um, and so it's just important to be able to have these conversations within the South Asian community and not sweep them under the rug.
Yeah, absolutely. I mean, you've given us such a fantastic, resource itself to start with. And I think so SAPHA can also be a wonderful forum to bring together public health professionals and perhaps professionals from sociologists and other fields to really help inform the people in our community and the people who work with our community to properly educate, women and others about reproductive health, and where they can get care.
Yeah.
Um, speaking of the challenge that you have faced since the Dobbs decision, so I think I want to just take a moment to, talk about how public health has been for a long time in the background, and it's really, even today, this is a medical care system in the United States, and public health is a very small segment of that medical care system and the sick care system, as some people would say. And of course, a little thing called COVID happened, and public health was pushed into the limelight and faced a lot of what was unexpected and sometimes even negative and vitriolic reactions among the public, who were misinformed and who were overwhelmed with worldwide. The public health community faced a lot of challenges. There was incredible burnout, which still continues among many medical specialties and public health. We've got significant spending cuts, and mistrust in public health agencies, et cetera. And recently, including the insurmountable challenges, or perhaps increasingly insurmountable challenges in reproductive health area, we've also seen pushback, as you're probably familiar with, pushback against DEI activities and pushback against any activities to improve health outcomes among racial and sexual ethnic minorities and LGBTQ communities and people who are differently able and people with disabilities. So, I really, given all of this, as a social scientist who relies on data and who relies on qualitative data, what advice would you have for the next generation of public health professionals to keep doing the work that they do and to keep the trust in public health and to keep working on equity?
Oh, goodness. Um,
Basic
yeah,
question.
I think, I
Let's
mean,
solve
all
that
of
in the next
that,
few minutes.
all of everything you said just supports that public health is more important now than ever before. I mean, it's just the fact that, we did go through the COVID pandemic, and no one stops to think, where would we have been without public health? It is so hugely important. And one thing people keep forgetting is that public health is about structures. It's about structural racism. It's all related. Structural sexism, gender inequity. There's so many contributing factors. Homophobia. It's all of it, and it's about looking at health outcomes, health and well-being. Not even just health. It's like about well-being, and how to change upstream level factors to improve people's lives. And like, what is more important than that? It is so critical that the funding continues for public health, and that I'll say it again, that public health for South Asians is also prioritized just like every other group, and that we are out there because a lot of people, they just don't have information, right? Just like about public health, about health, and about the different racial ethnic groups that are differentially impacted by policies. So I think our work is more important than ever right now.
Absolutely. Samira, over to you.
Yeah, I mean, you've really brought up so many great points. And it's just, I think, like Anita mentioned, I think public health is getting its time in the news, whether it's good or bad, but I think a lot more people are aware of it.
Yes.
I know for sure when I was in school, I had no idea what public health was until I
Right.
I was on the same pathway, go to med school. I was like, oh, there's this thing called public health. Why not explore that? But I don't think people can say that now. I think people know what public health is, and I think that it's just important to kind of jump on that and like really showcase how important it is, especially in South Asian communities, and how we're so integral to the work that's being done. And it's really work that people like you have been doing for so long that it's we're finally showcasing it. And I think SAPHA is the great platform to do that. So we're really appreciative of joining us to talk about the work that you're doing in your career. And so as we close, we just wanted to know if you have any closing pearls of wisdom for those who are aspiring to do work in this area, specifically South Asian public health, but also, public health in general.
Yeah, one of the things I have always loved about public health is that it's so consistent with my life values. Like it's, when, there's a mass shooting, I can say, yeah, this is a public health issue. And this is the reason we need gun control is for public health. And, I think everything that I'm passionate about, like access to abortion, it is about public health. It's also about equity, which is also public health. And so I think in terms of words of wisdom for those who want to get in this field, please do, because I also think there's just so much work to be done in public health. There's like a job for every personality type within public health too, and every skill set too, right? Like there's communications, or there's like math and, statistics, or there's, art and the community. There's so many different things that you can use your skill set, and whatever strengths you have, you can bring it and move public health forward. And so I feel so incredibly proud to be working in public health and to be a public health advocate, and also to advocate for South Asians in the US in terms of public health.
Absolutely. Absolutely. Before I turn it over to Samira for her closing remarks, I want to say you've given us so many good resources, and, your mentee who we would like to connect with as she continues to do research. We will link so that the listeners can take a look at. It's not from Stork. Is that the name of the book?
It's not the Stork.
It's not the Stork. I think it's
come
our
from
listeners.
the Stork.
Absolutely. And of course, we'll link the organizations that you are affiliated with as well, so that people can learn more about you and the work that you do. So with that, Samira, over to you.
Absolutely. We've learned so much from you today, and we're just so incredibly grateful to have you here. Thank you for taking us on this incredible journey through your experiences and insights. It's been really an honor to have you as our inaugural guest on the SAPHA Spotlight series, our first podcast, our first episode. And so we're just so happy to start it off with, one of the co-founders of SAPHA, and just a remarkable person who's done so much for this field and the field of public health in general, especially reproductive health. So we're just really, incredibly grateful to have you here today and to listen to you. And to our listeners, thank you for joining us on this milestone episode. Stay tuned for more conversations with past SAPHA board members. This year, as we are celebrating the 25th anniversary, we really want to highlight the contributions that people have made to SAPHA since its inception and where they are now. And so we will continue to explore their career progress, for those who have, paved the way for change within the dynamic world of South Asian public health and public health in general. Also, we'd like to, recommend that you follow us on YouTube and Spotify by subscribing to our channel, which we will also link. And then if you enjoyed this episode, please consider donating to SAPHA at www.sapha.org. Until next time, this is Samira
and Anita
signing off. Thank you.
Thank you.